So menopause boot camp.
Yes.
Um, you have your book, which everybody, after listening to this, go deeper there. And you offer menopause boot camp, which is
Yes.
a course that people can find.
It's actually an experience. It's an in-life experience. And in fact, interestingly enough, I don't know when this is going to post, but we just decided to do one. We're probably going to do one here in LA, maybe the end of April. I haven't done one in person for a long time. It's been really busy. So it started as an in real life event to do a deeper dive into these issues and topics because they were so largely misunderstood and people really were not getting good information. And also it was impossible for me to address people's concerns and needs in a doctor's visit. It just was not possible.
Mhm.
So that's how it occurred. Now what actually is happening is that we are also creating a certification program. So I really feel very strongly that this information not only needs to get out there, look, I'm a little bit in an echo chamber in some ways right now because I'm in the menopause space, but the reality is that most women still are not getting the information. They're not getting the support. They're not getting the tools that they need to uh, just experience another life transition. That's all it is. This is not a disease.
Right.
Okay. It's not a pathology. And I think for us to sort of reclaim the cultural narrative and our own personal narrative, it is a physical experience that is we're going through that is challenging. So we need a lot of different things. So I feel like what I've seen in my lifetime is that when we are facing these kinds of events in our lives, like childbirth, pregnancy, the fourth trimester, child rearing, those things have changed in the community, mostly from the community demanding change, not from the top down.
Mhm.
I think we have a lot of work to do in institutional medicine and in academic. That's not my world. I don't do that. I'm a private practice generalist physician and a public speaker. That's my wheelhouse. I know how to talk to people. And I think that people are going to have to take the reins. And so when I started doing the boot camps, what I saw very quickly was that it created a community. It created a lack of the isolation melted away. The stigma started going away, and people had connection around this and
Mhm.
support. And so I really am very serious about creating a grassroots movement, but I know that I can't be doing it all. So I'm gonna hand the reins over to y'all. I have a course with all the how everything from how to lead a group to what is the information, and that will be available to become an official certified menopause bootcamp leader probably sometime in the late spring or early summer at the latest.
Yeah.
So that is going to be a course that people can take. And then, but the point is to not just learn for themselves, but hopefully also to be leading boot camps themselves. Because the other thing too, Amanda, is like for me to go into your community, it's arrogant. Like I know medicine, I know my thing, I know menopause, but I don't know everything from Compton to Cleveland. That's ridiculous. Like you understand your community. And what I saw when I started doing these boot camps was that, as I mentioned, the communal aspect was really one of the most powerful things that came out of it.
Yeah. Yeah.
So I have there's a lot of momentum going on around it right now, which is it's beautiful,
It is.
actually.
It is. And I like how you do liken it to there's been a lot of work, especially in Los Angeles, where we are in the birth community, and just seeing the conversation change there. We've seen a real movement around hormonal birth control. So I feel like, yes. And how long have you been doing the boot camps?
I started doing them probably not like maybe 2018, 2019. And what happened is then the pandemic hit, right? So then the lockdown happened. So I had done a number of them, and then I was doing them online. And then I was the book. I mean, I knew very quickly, I'm like, oh, there's a book in this.
Yes.
So, the book, I read the book got sold, and the book came out like right when everybody started talking about menopause. So it was kind of interesting timing. But yeah, it's really only the last 4 years, 5 years.
Yeah.
I
Yeah.
mean, I've been doing menopause work for a much longer time.
Totally. But
Yeah.
creating that forum.
Yeah.
So I don't feel like it's arrogant for you to come into our community and talk about it. I am very grateful. And people have so many questions, myself included. I would say
Mhm.
the community is My community is probably 35 to late 40s. And so
Hmm.
everybody's on the edge or has just gotten into. So we have people ranging from, what are you talking about? Perimenopause starts at 35. Nobody ever told me that. And like, if you're in my community, you're tuned into your body. There's a
Right.
reason, you're following me there. So there's the nobody ever told me, and I'm 40. What? To I'm 51 and I'm just starting hormones, and I didn't think I'd ever go down that road, but like, oh
Right.
my God, it saved me. So we've got this spectrum.
Yeah. Yeah. Yeah.
So like, we'll kind of try to cover as much as we can in
Yeah.
that spectrum. So the first thing is, because people are still like, well, what is perimenopause and what?
Yes.
So just to
Yes.
place this in the
Yes.
conversation, could you give us everything that is perimenopause and the point at which you refer to it as menopause?
Okay, so this is really, really important. And this is a lot of what led me to start menopause boot camps, because if we're not even speaking the same language, then how are we going to get anything across? So let me just say this. The term perimenopause is really very fuzzy. There is no defined. Peri just means the time around. Peri is the Latin. We use Latin in medicine for a lot of things. That's how we talk. Peri is the time surrounding. That's it. That is all it means. So actually, I think it's really important that you said what you said, because it isn't like at 35, this is what happens. That is not how our bodies work. So
Mhm.
anybody who is, we don't remember our own puberties usually that well, but we don't say, oh, puberty starts here and it's da, 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 da. I understand people want to control the information to feel more comfortable, but I'm sorry to say, if you've gotten to this point and have not realized that knowledge is power, but you are not in control.
Mhm.
You have some, you'll be having the opportunity to face that again. It's an amazing opportunity, yet to more to surrender and grow. So let me just say that. But it is true that perimenopause is really what we're talking about. And I think the menopause moment and the menopause this and menopause that, it really is, to my mind, we're addressing the transition, the leading up to, and the change. Okay. Menopause itself is one day of your life. It is the day that you've completed 12 consecutive months without a menstrual bleed over the age of 45 for no other medical reason. You haven't had a hysterectomy or chemotherapy, you don't have a thyroid problem or some other reason why your period may be not happening. Okay. So again, I'm going to say that again. One day, 12 consecutive months, no menstrual bleed for no other medical reason over the age of 45. Now, here's the thing. People can have these so-called perimenopausal experiences for 7 to 12 years leading up. So yes, you may notice things that are changing in your 30s. You may not have anything that's really bothering you until you're 49. You know what I mean? The average age of menopause in North America is 51.4. The average lifespan is over 80. So we're spending at least a third of our lives in the menopause or post-menopause life. It's a
Mhm.
very long time. It's not like a one and done. It's not the end of your life if you're lucky. So we have to really understand the terminology and reframe. I think the other thing also is that the reason I have issues with the term perimenopause, and I talk about it in the book, is on the one hand, I understand where it came from. It came from this, something's going on and it feels weird and I don't know what it is. And I think the validation that occurred in saying, yeah, well, what's happening is your hormones are making yet another transition. You are feeling different. Your PMS is different. Your cycle is different. Whatever it is, your weight is different. Your experience in your body is different. Those are real things. I think it's veered into a little bit of pathologizing as if it's a disease, and perimenopause is a bad thing that you need to fix and you need to get your hormones balanced. And I am saying air quotes for a reason,
Mhm.
because
Mhm.
balance is a very dangerous word. Okay. Because again, it applies, there's something wrong, you got to do something. What you get to do is be in your body in a way that is safe, healthy, and comfortable for you. Okay. So I'm not talking about other medical issues that can occur during this period of time or can be a consequence of the changes in our hormones. I'm talking about that experience in a more generic way, It's very, very important to me because I think you could be at 37, your periods are getting closer together, and it's no big deal to you. Do I need to tell you, or do you need to feel like, oh my God, I have perimenopause? I you get to decide. But I think if it's like striking fear in your heart, let's take a look at what's going on with that. Like, what is that? Because
Mhm.
that to me is more about fear of what's going on in my body, fear of losing control, fear of aging, fear of being invisible. A lot of narratives that are very, very damaging and unhelpful and don't need to be your narrative unless you decide you want it to. The
Mhm.
other side of that is being in community with healthcare practitioners who can help you with things that are disruptive. Because if something is disruptive, it deserves your attention. It deserves our assistance.
Yeah.
Very,
That
very different.
it's very helpful to hear you speak about it that way. The way that I've been hearing other people speak about it is it's like this new definitive 35, you enter perimenopause. And so some of my questions for you were around epigenetics. And like that must play in, in the same way that like I didn't feel geriatric in my pregnancy after 35. Like, can I just put that fact on that same shelf? Um,
Yes.
yeah. So
Yeah.
yeah, you gave me your thoughts around that.
Well, and I don't think we totally understand. I mean, we don't understand ovarian aging that well, which is really underlying all of this, including the geriatric pregnancy, which is not a term any doctor uses, just FYI. Like it's such a triggering term. No, I've been practicing medicine for 26 years. I've never used that term. And we
Mhm.
do say advanced maternal age, that is true, but not to your face. Because it's triggering. It makes you feel bad. Okay, but that's not what the conversation's about.
Yeah.
But it is in a way because language is so powerful, and we consume it, and the way we are consuming content right now too is like really intense. Like some of it could be. I'm hopeful. You're hopeful that what we're creating here together is a conversation that is nourishing, enlightening, supportive, guides you in the right direction. But not everything out there does that. Some of it is very concerning or kind
Mhm.
of dramatic or creates confusion and dismay, which isn't really a great place to come from when you're trying to like deal with your life. So
Mhm.
I have a tendency to get very philosophical, so you can just cut me off because
Yeah.
that's because I think with
Well,
this
it's
it's very
really
important.
It is very important. And, there's a part of me that when I heard like, oh, perimenopause, like probably starts around 35, there was part of me that got really inspired by that,
Hmm.
like inspired and excited. That's me though,
Yeah,
it's
yeah,
like,
yeah.
oh, it's like same with birth, same
Yeah.
with like the rhythm methods,
All
same
right.
with an autoimmune condition. Like that's just me.
Right,
And I
right,
love like
right.
really getting into the body and nerding out. But then I saw like, ooh, talking about it, me coming from this place of like perimenopause starts at 35, like we're in it, we're on the ride. Let's optimize this. I was also hearing from a lot of people that was scary and
Yeah,
felt like
yeah,
doomsday, and they had no
yeah,
idea, and
yeah,
they were already
yeah,
past their prime and didn't know it. And so,
yeah, yeah.
so thank you for grounding the
Yeah, of
conversation.
course. And just to your point about epigenetics, I mean, what I was getting at is like we don't understand a lot of how our bodies work. Like we have we understand a lot, but why does this affect you this way and me that way? Some of it's genetics, some of it's epigenetics for sure. Lifestyle, stress, all sorts of things. We do know that, and I think this is frankly like when you look at I'm going off topic, which I do. Like if you look at, for instance, racism in medicine, I mean, that in a way is almost like an epigenetic impact, right? Because people literally are experiencing racism, brown and black people, and they have different outcomes. And some of their different outcomes are because they're being treated differently. Some of their different outcomes is because they're being treated differently in life, and it affects their own cortisol, stress, inflammation, disease process. And then they go into a healthcare system that treats them differently, looks at them differently. So outcomes are different. So it's not really biologically plausible that your skin color is going to make your body do something so differently, but people's experiences become different, and it's complicated. My point is like there's culture, there's society, there's all these isms, there's what you're bringing to the table, and some of it is just it's not really clear right now. So you're right, answering the question of like, when does it start? Usually what I tell patients in a clinical setting is like, you're going to know when something is going on. Like if you start questioning, like, why is my body doing this? Like something's going on, you know, your body,
Yeah.
you
Yeah.
know?
And what are the common kind of like beginning symptoms? And then what are the really uncommon symptoms
Okay.
that you
Okay.
watched?
The most common early indicators are changes in the menstrual cycle. So for a person who is having a monthly bleed, okay, we're just going to go there because it's too complicated to talk, like, you know, people have different experiences, right? They have an IUD or they, whatever. But people who are having a menstrual cycle and bleeding, usually they'll notice first that their cycle sort of shifts around a little bit, like maybe their intervals are closer, they're bleeding closer together. The bleeding gets a little bit heavier. The other thing that really can strike sort of out of the blue is that premenstrual phase changes and morphs. There are biological reasons for that. Everybody knows, I think most people know that part of what's going on is as we're aging and the ovary ages and we head into perimenopause and toward menopause is estrogen is declining, but also progesterone is declining. So progesterone is made in the second half of the cycle by the ovary after it ovulates and releases an egg. Progesterone is made in order to support a potential pregnancy. When you don't get pregnant, everything declines. The lining of your uterus, which was built up by the estrogen in the first half of the cycle, sheds, that drops off, the progesterone drops off. In that space between ovulation and when you bleed, as the progesterone starts to decline, and it's declining a little more rapidly than the estrogen, people start having symptoms. They start having breast tenderness, feeling pregnant, fatigue, flu-like stuff. That's a little bit less common. Here's the big one: mood changes.
Mm.
Not just like gnarly, crying, weepy, that kind of thing, which people get, but they get very dark. People get anxiety and panic out of the blue. And I think people get misdiagnosed a lot with anxiety disorders when maybe it is, and maybe it does need mood meds, but maybe it's perimenopause, you know, maybe it's just the shift in the hormones. I think these are some of the more common findings that I see. They can be subtle to the person experiencing them because they're kind of coming on slowly over time, and it's not so easy to recognize. Vaginal dryness can start happening. People may not have like that classic, you know, genitourinary syndrome of menopause where they have global irritation and dryness, but they may notice that they're not lubricating the same way with intercourse. Their sexual experience may be different. They might be having a little bit of discomfort or pain even. The less common stuff that people start to notice, dry mouth. It's not that it's less common. I think it's less recognized. Dry mouth, burning mouth, dry eyes, skin stuff. Like all of a sudden I see people getting inflammatory conditions in their skin who didn't have, like they get eczema or psoriasis that they never had. They're more sensitive. I've had even people have like new onset asthma, allergies,
Mm.
um, you know, joint pain, obviously sleep disruption, which can be just from sleep changes because there are hormones as we age that change. Melatonin declines, vasopressin declines, but also people are having maybe night sweats or night flushing and they don't quite realize it, but it wakes them up. So then their sleep is disrupted. And the mood, of course, is worsened because they're not sleeping well. Joint stuff can become a thing. Frozen shoulder. I'm
Mm.
making it sound really fun, aren't I?
Mm.
You know,
I'm excited.
frozen shoulder is a big thing in midlife women.
Wow.
Can I prove that it's perimenopause? No, but I think everybody's pretty suspicious that it has something to do with changes in hormones. So, and then brain fog, cognitive things. People get freaked out, like they're forgetting stuff. Why did they go downstairs? They're worried that they're like having early onset dementia or something like that. And we know that there are changes in your brain. And here's the deal, Amanda. We have estrogen receptors in pretty much every single tissue in our body. So this is not meant to scare people, but there's an explanation for why people start feeling different in their body. It isn't just the menstrual cycle. The estrogen receptors are not being activated in the same way because estrogen has changed and declined or is fluctuating. I have a great slide that when I give a talk that sort of shows like the smooth, beautiful menstrual. And then perimenopause is like this insane roller coaster, like everywhere. And that's kind of how you feel, right? It's like super unpredictable. That's the
Mhm.
other thing, is the predictability is altered.
Do you, a lot of the symptoms you were talking about sound like they involve the immune system? Is that?
Um, Immune and inflammation. I see it more as inflammation. Estrogen is a really interesting molecule, and I could get really nerd out, but estrogen, first of all, estrogen is like, there's more than one kind of estrogen, right? And we have more than one kind of estrogen receptor in our body. So depending on which estrogen, which form of estrogen and which estrogen receptor is being occupied or not occupied is going to have an impact on your body. And although famously too much estrogen can increase inflammation, right? We know that, for instance, during pregnancy or when you're on any kind of estrogen containing medication, your risk for developing a blood clot is elevated because of the impact on the lining of your blood vessels. But there's something also sort of anti-inflammatory about estrogen in other receptors and in other parts of your body. And so I see estrogen sort of almost as a lubricating hormone. I'm really like oversimplifying it here. But as estrogen becomes production becomes unpredictable and then declines, we're seeing more inflammation in the body as a result of the loss of that estrogen, if that makes sense.
Okay, got it. Um, and then so the age range that you see, just because I know that people are going to be really fixated on like, yeah,
Yeah,
I
yeah.
know talk ladies, but like when am I going to feel? So just what do you see with your patients? Age range?
Well, I do. I will say I think that my younger patients are much more attuned, and I think that you guys have had a different experience of your bodies growing up and a different conversation about things than women and patients of mine who are older, where stuff was really not discussed. I mean, look, you were raised with books about your period being in the children's section of the bookstore. I had where, Are You There, God, It's Me, Margaret, which at least I had that. But, like I raised my kids very differently than I was raised. So some of this is you guys are just more aware and there's more acceptance of like, oh, what is happening? Questions. So I feel like I'm seeing people coming in their late 30s who are asking me questions. Now, also, I'm known to do this. So I'm a little bit skewed, right? Because people know that I do this. I had a funny experience before the book came out. I had a patient in who was probably mid 30s, and we started talking about this and she had questions, and I told her I had a book coming out, and then at the end she was like, so what was the name of the book? Menopause for Millennials? Which really made me laugh because I was like, and scene. No, actually, it's not for you can read it, but everything is not about you. Just so you know, Gen X, we're dealing with it. Okay. So, but I do see people coming in their mid to late 30s with questions like, do you think? And I'm like, yeah, it could be. And here's the deal. If a lot of times what happens is when people come in and ask me, all they wanted to know was like, can we have a conversation when I'm ready? Or be validated like, oh, I'm not crazy, this is different, but it's not bothering me that much. And I can figure out what I need to do, or I'm gonna look at your book, or I'm gonna read online or whatever. More consistently, like disruptive stuff tends to happen mid to late 40s. The more disruptive stuff is usually much later than that, in
Yeah.
my experience.
Okay. And this is like, we don't need to go on this tangent, but a little side note is, have you seen people that have gotten COVID and maybe they fall into more of like the long COVID bucket that have had like kind of perimenopausal? Because
Yeah. Yeah.
I got COVID, I fell into the long COVID bucket. I'm very sure that, the virus went into the soft tissue of my brain and definitely hit my ovaries first and harder. And so I felt like it felt very perimenopausal, and
Yeah.
and then stopped. And
Yeah. And we're not going to know exactly what that is. I mean, I think whether or not it actually is having a massive or any hormonal impact, nobody can say. I can tell you that. There's nobody who can say that with authority. And I think the other thing about it is because of the way I described a lot of the perimenopause symptoms, especially that early subtle stuff. I mean, it feels the same way. It feels like I said, there is sort of almost like a flu-like syndrome that people will get in PMS. So, and that I think you're right, is maybe immune, inflammatory modulated. So I can understand why some of the long COVID feelings might feel perimenopausal. I don't know that we can say anything more than that at this
Mhm.
point. I definitely have seen people have transient changes in their cycle when they get COVID, but that's also true if you get sick in any way. Like people, when they get sick, their brain says survival does not include me ovulating. Like, in fact, it's not a good idea if I'm sick to ovulate. It would be a bad idea. When
Mhm.
people get really sick, their cycle gets disrupted. This is not just COVID, this is illness.
Mhm.
So I have not seen anybody have permanent changes. I've definitely seen people with like a weird period, a super crazy heavy period,
Mhm.
skipped periods,
Mhm.
and pretty much all of them are coming back. But
Yeah.
there's just, we don't, there's so much we don't know, you know?
Yes.
Yeah.
Um, okay. So what do you think, for the people that are really excited by this conversation, for the freaks out there that are really excited about the thought of like perimenopause, like a new hormonal project, what are some things that they can do? How about like even 20-year-olds that are like, yes, perimenopause, I'm gonna like rock that when I get there. Are there lifestyle things? Like what can people be looking at considering in maybe even their 20s, their late 20s, 30s, 40s?
You know, really, that's such a great question. And the reality is it's really just around, it's about healthy aging. It's nothing more than healthy aging. And it is true that, listen, you have the opportunity today to look at your lifestyle and make changes that make sense for you. So I certainly don't want people to feel like, oh my God, it's too late, I missed the boat. I don't think that that's ever true. But it's also true that you are setting the foundation for your lifelong health early in your life. I mean, we know that there are, I mean, you know, I'm sure you know this, but there are prenatal impacts on lifelong health, you know? So, not to scare anybody, but this is why we advocate for, you know, taking vitamin D, omega-3, folate, you know, folic acid before pregnancy, right? Because those things have an impact on the developing fetus before you're even pregnant. So, you know, and lifestyle is really where it's at. I think developing healthy habits, um, exercise to me is actually the most important thing, and also understanding how to alter your exercise as you change in different decades of your life. So, you know, your muscle building and your bone building, well, bone building in particular in women really stops after your 20s. You're not building bone anymore. You can maintain bone, but you're not going to build bone. Muscle mass has to be worked on more and more as we age. We start as our testosterone and estrogen are declining, which is happening, you know, much earlier than people necessarily realize. We can still build lean body mass, we can still build muscle, but we have to work harder at it. The
Mhm.
other side of that is as we get older, so 20s and 30s, I mean, part of me wants to be like, do you know? I don't know. But I mean, I was working out, you know, consistently in my 20s. I always have been a fitness person for both, just to feel, really, I did it to stay in shape, but to feel good. Like, to me, it was like my therapy.
Mhm.
Um, and that, I think, just finding the movement practice that is strength building that you enjoy doing is really important. What you eat obviously is what's making your body tissues. What happens as you get older is it gets a little bit less forgiving. You have to be more on top of things. And then as you get actually into your 50s and older, over exercising is not a good thing. It turns out that there are some newer studies. So, you know, I don't want to do like whiplash, what I call whiplash medicine. Like, the new study came out, we're doing that. No, now we're doing this. But I think it is common sense, and it makes sense to me. And it shows that certainly as we age, actually fewer number of workout sessions might be better. So not so it, there was one study, and it was looking at people older than me, but optimal weight, muscle building and weight management was at 2 times a week of resistance training and 2 times a week cardio, not more than that.
Still
So,
sounds like a lot. If that's like toning it down for
well,
you.
but I mean, well, I'm in LA, so you know people, I mean, you are here too, I think. I mean, people here go crazy, and I have people coming into me all the time like, I'm spending 5 days a week. Why am I not losing weight? I'm like, girl, calm down. Like, you're hurting yourself. Like, your body is literally at cortisol. It's so stressed.
Yes,
So,
I have actually been to that place. That was my like number one body hack, was to actually calm down. And I think also like considering lifestyle, I was running a company. I was a single parent. I was like exhausted and making myself go do this thing because I thought it was the healthy thing to do. And actually
mhm,
now
right.
I think I've gone too far because now I just walk and like hang out with my toddler. I actually need to do some muscle building strength.
I think you should do that as long as you can get away with it. I mean, here's the, because that's the other thing too, is like, also honestly, mindset, which includes sense of humor. Like,
Mhm.
what are we doing on the planet if we're not really enjoying the moment that we're in? I'm not saying you're going to enjoy every moment. And I'm definitely not here to say like menopause is awesome. All of it is great. Some of it fucking sucks. Okay. Like it is not amazing, like not sleeping. Okay. That does not feel good, but knowing that you can like laugh about it and that you
Mhm.
have there's something on the other side of it is tremendously important. And that kind of community is the other thing here. I think we can get really, I can see you and I, we can get deep in the weeds with like studies and the things, and that stuff is really important, and it informs a lot of my decision making and my background and how I present things. But also, like, I think the data is also there to support social connection, community, and spirituality, whatever that means to you. I don't have any prescriptive with spirituality, but we know that slowing ourselves down, appreciating something bigger than ourselves, seeing ourselves as a part of something bigger, gratitude, these are not just feel good things, they are data driven, beneficial activities.
Mhm.
They, as you mentioned, slowing down brings down your cortisol, brings down inflammation. Sleep is so important. Everybody talks about it. Nobody wants to actually do sleep hygiene, as it turns out.
Oh,
But
really? I love it. I feel like that's my most indulgent part of life now, is just
so
the,
happy you're doing that.
yeah, me too. It's been a game changer. No, I think what you're saying about community is incredible, because if we can go, I feel like as women especially with other women,
We need it.
oh yeah, we need it. And you can really
Mhm.
sink into like it was the
Men
best
need it too,
time,
by the
it
way.
was
I mean, we're
they
not talking about men right now, but men need it too, and they don't
do.
always naturally go to it, but that's another conversation, and that's on me. I
Yeah.
know I'm being very gendered about this, but there's just, it is what it is. But that's another thing. Like I said, I created menopause boot camps. Maybe I didn't say this because I thought people wanted and needed the information, and they came for the information and they left with community. And it was a real lesson for me because I'm a lifelong community person, right? And I don't know what I was thinking, that wasn't going to be the healing balm that really was and is. And now I'm seeing it in this momentum around the conversation and the subject, people coming together. I was just at an event this last weekend that was so, I mean, it was so fantastic, really, because of the energy of the 300 people there, like just coming together to take care of ourselves and each other. Wow.
And I feel like that's one of the beautiful gifts of being a woman, and knowing to just, get a little prescriptive about community. Is I think maybe there was a time in my life when I felt a little hung up on who my friend's going to be. And no, at this point, I made a move 2 years ago, and it was really like part of, I'm just going to take my vitamins, I'm going to brush my teeth, I'm going to take a shower, like I'm going to make myself take a walk, was also like, I'm going to find women and I'm going to have radical intimacy with them. And I care less about like what they're up to, what they're thinking. Are they a kind person? Can they be honest? Are they down for intimacy? And just
Hmm.
like finding those people and getting kind of like schedule it, get prescriptive.
Totally, so important. Really, probably the best medicine that
It
there is.
really, yeah. You can
Yeah.
think about any phase of life, and if you have those people around you, it's really like if you can laugh, you said it, it was the best of times, it was the worst of times, whether you're like pregnant and not sleeping, or out there and dating, and it's like the good, bad, and ugly, and you can laugh
Hmm.
about it, raising young children and just
Hmm.
like commiserating and laughing. I feel like, you know,
Yeah.
perimenopause, menopause.
It's very, very, very important and very healing. And the removing the isolation around it. So, like when you said that there were, younger folks that were like, oh my God, what? It's okay to feel that way. But I think what they'll find is that when they are ready to approach the information, doing it around other people is so important. I think the other thing, honestly, that you and I are doing right now, which is really powerful modeling, is intergenerational conversations,
Mm,
because this conversation thread was disrupted. A lot of us have never had this conversation with older people in our lives, our family, our community, whatever it is. It's complicated why that's also about community and family disruption, I think, too, but also because a lot of times anything that is a woman's narrative or story gets sort of sidelined or hidden,
mm,
and is lost, because a lot of I'm a student of traditional medicine, and women's health in Ayurveda is largely oral tradition. I mean, what's written in the texts of the Vedic, sages about women's health is really about like how to produce a royal heir, because even 6,000 years ago, the patriarchy had taken over.
mm.
So I think,
How to
honestly,
satisfy 1,000 husbands.
right, right, exactly. Right. Shatavari. That is exactly right. It's interesting, correct? Like
Yes.
that you and I could have a whole conversation about
Right.
plants and plant medicine, and really whose plant medicine experience was that? But okay, you do you. Um, I There were a lot of things that came to bear in my own life, personally and professionally, that created Menopause Boot Camp. But kind of the capstone for it was that I was invited to speak publicly by someone 20 years my junior, Erica Chitty. She brought me to the wing. She said, I want to interview you publicly about menopause. And I was like, okay. I mean, she knew I was doing this work, and I was like, interesting. And it was just a watershed moment for me, because I realized in the middle of the conversation, oh my God, like, we're not talking about this older woman to younger woman. That's hugely important. And, now I'm kind of embracing my sagely years, like I'm down with it. Like I'm vital at I'm not afraid to say that I'm 57. I'm proud. I'm fucking rocking it, man, as far as I'm concerned. But I have 57 years on the planet of experience to share. And I have women that are older than me that I share with me regularly. I am so blessed and honored by that. And I think reestablishing those connections is very, very important. It's much less scary when you have somebody to look at as
Yeah.
a role model or as a font of wisdom who can help guide you. You get to make your own decisions around this,
Yeah.
but there's somebody there to point out, maybe you want to try that way, not this way. Or, when you go over there and you get lost, feel free to give me a call. you
Yeah.
know, I'll
Yeah.
be over here.
Yeah. This is an amazing moment for me having this with you. And then another one, I think she's in her 70s. Another one that I had earlier this year was Patti Smith. um,
Oh,
and
oh
spending
my
time
God.
with her in New Mexico. And she's in her 70s and she's like on stage in the rain at, the Ghost Ranch.
Mm-hmm.
Georgia was like another, she's not with us today, but again, like looking at her creative spirit, looking at what she created, looking at her with a shotgun out there in that land, in her 70s. Yeah, but Patti Smith, like vitality, energy, the creative force running through her, this like just like punk rock reverence, like
Mm-hmm.
kissing in the dirt in front of everyone. Like, it was.
Which is what she would have done when she was 30. I mean, that's really not why. That's the other thing that happens. I think I really get why people are scared, and I get the grief and fear around changing and aging, especially in a culture that does not revere older women specifically. We are dealing with misogyny and ageism. It's very, very powerful. These are powerful forces. My during I don't even know if I figured this out where on the journey of the book and the menopause boot camps. Didn't start with this actually, but I really got to a point probably during the press, to be honest, last summer, just talking and talking and talking and talking about. And I said to myself, and I said to other people, I said, here's the deal, that narrative is not mine.
Mhm.
Have at it with that narrative. I don't think it's working out very well for the planet.
Yeah.
It's not mine. I refuse to adopt that narrative. I have my own narrative, which is all these things that you're talking about. I am so creative right now, and I have so much energy to invest in my curiosity. Like these are all things that I always was. I didn't become old, invalid, and lose everything that I liked about myself from before. I'm like becoming more who I am. So I do want people who are anxious and worried to know that it's totally okay. I want to give you a hug. Like, you're allowed to be anxious and worried about this. But also, like, you get you what happens is women in our 50s gives ourselves a lot more permission to just be us, you know, like, this is who I am, and unapologetically, it's kind of great.
It's kind of like, I feel like maybe, sorry, I just
I
aspirated
know, I know,
dust.
I know. Take your mo. You okay? You look like you
Yes,
need to like
yeah, I'm
drink
gonna
more
start
water. Okay,
tearing in one eye.
okay.
Um, it's maybe there must have been some point where it was like that maiden to mother felt like
Hmm.
the death of a
Yes,
woman, the death of her sexuality, the death of her independence, the death of her beauty, all of that. It's almost like you and your colleagues are starting this the generation
yeah,
of whatever we want to call that,
yeah,
but really celebrating and expressing in every phase. So
yeah.
it's kind of like the do you like the word crone? I kind of like it.
I'm not offended by it. Like, I'm not offended by
I
it.
like it. I'm into it.
Because I think it does conjure up like a certain image, and like, again, like, I mean, words definitely are powerful and they matter, and I don't have a problem with it. And thank you for asking whether or not I like the term, but I'm not that easily offended. And, you know, I'll tell you if I am, but that doesn't bother me. That doesn't bother me. But I can see why some people might be like, I don't want to do that way.
I like it, and
I
so
think
I
it's cool
use
because
it.
I also see myself as kind of like a witch anyways. So like, I'm just like more open about it. It's not like I wasn't a witch before. I always was a witch. Well, how do you think I ended up doing what I'm doing? I mean, now I'm like outing myself fully, but anybody who knows me knows this about me. This is not a secret. I am a doctor. I am board certified. I do my board certification every year. I do surgery. I believe in drugs. However, there's some other things going on there, you know,
However,
and
she's a witch,
but I'm also a
like
witch.
standing at the portal of life and death daily.
No, I mean, but you had, in order to do some of the stuff that I have done professionally, like, it's a whole different scene. Like, being at birth, come on,
Yeah.
a
So
lot, like thousands and thousands of them. If that doesn't affect you, I don't know what will.
yeah, you're in ceremony
Hmm.
daily.
Totally,
Yeah,
totally. Yeah,
yeah,
I don't do it anymore, but because it takes a lot out of you. But I learned a lot. I learned a lot about myself, other people, patience.
yeah. Well, yeah, so I'm into crone. Crone feels very
Yeah,
witchy.
do it.
Crone
Let's do
feels
it.
like, like the tarot card I always wanted.
Yes.
Um, yeah, so I feel like you're kind of ushering us into this realm of from mother to crone.
Yeah.
And it's like if we're going from like maiden to mother, there's like that drop into power.
Hmm.
And then from mother to crone is a whole other level of
Yeah.
power. I don't know. And you've been through it, so tell me, but my fantasy about it
Well,
is
I'm not done, technically,
we're,
if you must know.
we must
I think
know.
I'm day 188, so pray for me.
Okay. Okay.
But
Um,
anyways, yes,
well,
I'm definitely on the other side.
my fantasy is like mother is sort of like you drop into this like earthly grounded power, and crone is you kind of elevate into this more intuitive
Hmm.
like mystical power.
Yeah, that is my experience. And and also I think the other thing is, like, look, we all have different roles, like, that we are simultaneously occupying. But yes, that is, I resonate with that very much. Hmm.
I want to, well, I was going to end the conversation here, but we'll do this because we're here, and then we'll
Yeah,
kind of get into some
yeah.
technical stuff. But like the silver lining, it's like, okay, we're going to go through this, however you want to look at it. It's like a puberty moment, or it's like a postpartum moment, or like some other hormonal event as women that we go through. But there's the gift on the other side.
Totally. And I think that's exactly right. I think the silver lining is the gift, and the gift is you. You are your own gift.
Mhm.
which is beautiful. It's beautiful. There are so many other gifts, but I do think that like tapping back into your authenticity, um, your your uniqueness, your own beauty, your own strength, understanding what you will and won't do, what you can and can't do, and like, you know, turning back toward a sort of unconditional acceptance and belief in yourself. It's pretty great.
Mhm.
That's been my experience, and being really having more opportunity and time for creativity, which is something that for me is really, really important. And in those years of building a career, going to medical school, being a mom, running a household, all that stuff, like I just did not have time for that, right? I was like taking care of people, which is fine. That was a choice that I made. But I've had the opportunity to reestablish my own relationship with me, which is so awesome. And
Mhm.
in the process, what's happened is, as you mentioned, like the connections with other people have really flourished and grown, and really brought really interesting, wonderful new people into my life that are like-minded and just super interesting and beautiful people. So, you
Yeah.
know,
Yeah, and I guess I always think of my grandmother, which this can touch upon, maybe some of the fear that people have around becoming invisible. But my grandmother was extraordinarily beautiful in her youth and extraordinarily beautiful well into her 90s as well. But, going from that like sexualized beauty, and she lived in France and would tell me these stories about just like you just couldn't go anywhere. She hated it, but it was like the whistling, as was a little more strong in Europe
mm-hmm,
than it was
mm-hmm,
here. But she would always tell me as I was growing up, like, oh, it's so great when you get to the other side and you're no longer getting like hollered at and whistled at and that kind of attention. She really celebrated that and felt like she could finally just be a person in this world and
yeah,
travel and not have to get heckled and
yeah,
like talk to younger men about their interests and their culture. And she was like forever talking to a cab driver and this and that and
yeah,
taking like
yeah,
male students from all over the world into her home. And I really saw her love that and love her
yeah,
role as a human and
yeah, yeah,
carry a human around the world rather than a sexual object having to protect herself around the world.
yeah, yeah, yeah. I can see that. I mean, I think we could have a whole another hour and a half on sexuality too, because sexuality remains actually very important for people as they age, depending on who they are. But again, I think the operative is what you said, that she didn't feel objectified. I think that's another thing you get to be in charge of, because it is true when you walk through this world, the way things are set up,
Mhm.
as a woman of a certain age, I mean, you are not seen as a human, you're seen as whatever it is that other people are projecting onto you. I mean, we're seeing that happen in so many terrible ways right now, too, right? Like people project their stuff onto women. Humans project onto each other all the time, but there is something very distinct about that. And it's true that, like, this is an opportunity, I think, for people to reinvent and re-explore what their sexuality is for themselves, which is can be a very different, it can be challenging because things can change,
Mhm.
but it can be also really beautiful and authentic and deep.
Mhm. Yeah. Um, okay, so we're doing this and we're getting to the gift on the other side.
Exactly.
Um, so would you say, I've heard before that perimenopause can feel like the way it may pop up for you is however you're experiencing PMS.
Mm-hmm.
It may be like a more intense version of that.
Mm-hmm.
So would you
Definitely.
say that for somebody that maybe doesn't get physical symptoms of PMS and it's just like full mood, they'd have a moody version of perimenopause, less physical?
It's hard to say what's going to happen for everybody, but I will say this: people who have a history of any mood disorders are definitely more likely to have a recurrence of that mood disorder in perimenopause or toward the transition. That we know for a fact. So people who have had struggles with anxiety or depression earlier in their life around a pregnancy, they're definitely more likely to have that start to crop up. And a lot of times what I see is it's that PMS. And as I may have mentioned, that, maybe your PMS was 2 days and now it's 10 days or it's 30 days because you skipped a period. And that can be intensely disconcerting and very uncomfortable and really disruptive and harmful. The other thing that seems to happen out of the blue for a lot of people who have not suffered with mood issues is specifically anxiety and panic.
Mhm.
And that, what I see is that it's probably related somewhat to the decline in progesterone in the second half of the cycle for people who are having it in that part of the cycle. So like if you're all of a sudden having anxiety, what I always tell my patients is like, let's track a couple of cycles, right? And see, because if it's pervasive and every day, it's not really just hormones, right? It can't be, because your hormones are still fluctuating. But if it is really like that time of the month, that's probably what it is. And that will help us focus on solutions, and there are solutions. But I think the other thing that we see is a lot of women, I mean, we know for a fact that women's use of mood meds far outstrips, men's. And I think some of it's complicated, but you see it a lot in midlife, including in your 30s. And I think some of it is probably hormonal. Now, that's not to say that Lexapro may not save your life. Like maybe you have terrible perimenopausal PMS and you want or need Lexapro. I'm not saying don't use it. I'm just saying like having a thoughtful conversation and recognizing it might be helpful as well to contextualize it.
So I feel like the big one that everybody is really curious about is hormone therapy. And
Yeah.
so do you want to start there, or do you want to start with some botanical, mineral, natural, whether it's like acupuncture, herbs? Which one do you want to hit first?
I mean, let's do. It doesn't matter to me. Let's do that.
Okay.
First of all, let me say this: there's no one size fits all. Working with botanicals, I mean, I make recommendations and I have a whole chart in the book, and I'm very, very particular about what herbs, where you're getting them from. They are not all created equal. Okay, so let's just start with that. Try not to be your own doctor. Having said that, I think there's some low-hanging fruit that's pretty safe and effective for most people, but it's trial and error. So when you're using botanical medicines, they are not pharma. They're not going to work in 2 to 10 days. They're going to take 60 to 90 days to work of consistent use. For what we were talking about specifically, I absolutely love chasteberry or vitex, and it works really well actually for the physical and the mood symptoms for a lot of people. We don't understand, here's the thing with herbs that I love, but makes my very straight and narrow colleagues crazy, and that's something called the entourage effect, right? So when you're looking at a whole plant or a leaf or a stem or a root, it's not one phytochemical. It's not the one thing you can pull out. There's a lot of really interesting data on these things, and I kind of like to dig into that, partly because it's interesting to me, partly because I know when I speak to my conventional colleagues, I want them to see some data and be like, well, it's the, chasteberries. And one of the things it does is it looks like it increases your own production of progesterone in the second half of the cycle. So that's probably one of the ways it's working. That's only one way. And I think when you look at botanical medicine, you have to look also at like understanding and respecting the plant. I don't think everybody has to do a ritual in order to take supplements. Let me just say that. But like, I just feel like I want to say that because I want to have some respect for the indigenous practice that they came from, right? Like, every culture has lived with its environment and made use of the environment in a way that is beneficial to them and their locality. And in Ayurveda, I'm trained to look at like what's locally available. Okay, so I'm being very philosophical as usual, but chasteberry can be really helpful for PMS. Black cohosh can be very helpful specifically for hot flashes. Looking at your minerals, so looking at basic nutrition is really important. And it's the obvious stuff, whole foods, less processed, less sugar, less alcohol, especially at night. Alcohol at night is a disaster for sleep, for hot flashes, for inflammation. And there's a lot of really interesting research, now on like the order in which we eat food and the window between your last meal and dinner, and sleep, and how well we metabolize, but also how well we sleep, right? Because if we're spiking all night long, that could be disruptive to our sleep. But basics, omega-3 fatty acids, vitamin D, magnesium, and there's many different forms of magnesium. I have a whole post on it. Those are the basics that I want people to make sure they're looking at. You can do a deeper dive into what micronutrients you mix, selenium, choline, zinc. Sometimes these are out of balance and they're having an impact on our hormone production. The phytoestrogens, so things like Russian or Siberian rhubarb can be very helpful for hot flashes. It turns out that things like red clover and all these like soy isoflavones, they can be helpful, and the data is pretty robust. I just don't use them that much. I don't find they work that well, to be perfectly honest. And then there's sort of like all the cruciferous, the DIM and all that stuff to help. And here's, I hate this term, but in perimenopause, sometimes what's happening, I mentioned it a little bit, was that it's not just that estrogen's declining, it's progesterone and the ratios are changing. I don't like talking about balance, imbalance, because when we're talking about perimenopause, it's not an imbalance, it's a change. I'm not trying to make you be 30. I'm trying to help you be 37 in a way that feels good to you. But sometimes we're making more estrogen, and that's uncomfortable for us. And so some of these DIM, decalcium glucarate, indole 3-carbonate, carbinol, basically that's coming from cruciferous vegetables. Those can be helpful for people. I mean, you're not going to eat like enough Brussels sprouts to make this happen. You need to get a supplement. So these are some of the things that I like. I could go on and on and on. We start to lose melatonin as we age, and there's a lot of controversy about how to use melatonin. But my understanding is actually that replacing a lower dose of melatonin on a regular basis is actually a far more effective than reaching for your melatonin like a trazodone or an Ambien, because that's not what it is. So, and then of course, being in the light will help you produce the melatonin that you want. So I could go on and on about this, but there are a lot of things that people can do on their own. And a lot of it just involves thoughtful and careful assessment of their own lifestyle, and working with somebody, hopefully, who understands some of these bigger pictures, but also not getting too caught up in spending so much money, and also not falling prey to a lot of bullshit artists out there, or people who think they know more than they know. I'm just going to go ahead and say that there's a lot of predatory stuff happening out there, which leads us to hormones. So,
quick question for you there. So I've been taking Vitex for probably since I was 35 or 36. And then DIM I take intermittently. I have estrogen dominance. I don't know. I have a clean diet. I like don't use plastics. Is it
but that's what I'm trying to say. But Amanda, what I'm trying to say to you is that, see, estrogen dominance is like one of those terms out there. Now, it's not a medical term, really. No, it's not a conventional medical term. It's a term that's used in other medical practices. So, but it's also kind of like, I feel like it's one of these things. It's, again, about balance. Like estrogen dominance, like what the hell is that? Estrogen dominance is really just you're the age you are. And so the estrogen progesterone balance is shifting. And that's actually not abnormal. It's normal. It's physiologic. Now, you don't have to feel good or like it. And so that's why I do use DIM, or I do use some of these things, because it helps some people, but not everybody. And you need to understand with some of these specifically for the estrogen dominance, a lot of this data is not clinical. It's lab-based, and there's a theoretical benefit. Now, we could really get into a deep dive here, because we don't know exactly what metabolic pathway your estrogens are being detoxified through, which, by the way, is what your body does. Like, I'm not saying you need to detox. I'm saying that's actually what your liver's job is. And there are pathways, and some people make more or less of certain estrogens at this time in their life, which make them feel a certain way that they don't like. So yes, we can work on that. Do you see the difference in terms of, instead of turning it into like you have a disease?
Yeah, well, I'm actually glad that you said that, because people will look at me and look at my blood and like, oh, you've got estrogen dominance. And so I'll be diligent and take the DIM. And I actually find like DIM works very quickly and is very potent.
Yeah.
And in 6 weeks, my estrogen will drop into what doctors will feel like is a really good range, a healthy range. I don't actually feel good. It's interesting. I was noticing my husband was also like, I just noticed like we've been so chill. It's been so pleasant for the last 2 months. And I'm thinking like, yeah, I've been on DIM, and there's a part of me that actually feels a little like flatliney.
Mhm.
And I don't know, I feel a little more passionate with my natural estrogen.
Well, so you are bringing up something so important. Here's the thing with your doctors that are doing all this testing. I would love to see the data that they're relying on to tell you what these numbers are supposed to be, because it's not highly vetted and it's certainly
Mm.
not agreed upon. And hormone testing is a slippery slope. I'm not saying necessary for most people. Absolutely fucking not.
Mhm.
We manage these things clinically. Now, that doesn't mean I never test hormones. There are points at which we need to. But in general, especially if we're talking about perimenopause and menopause, that's not where the robust data is. That is not where the science is. It's made up and it's diseasifying, it's pathologizing. Okay, with your thyroid needs to be between here and here to have functioning. Like if it's up here, it's not normal. If it's down here, it's not normal. Your body isn't going to work well. You're going to get sick. That's not the case with your reproductive hormones. They are designed to alter and shift.
Mhm.
Perimenopause is cuckoo town. It's not a disease. It's just being alive. If it's just, I'm gonna say things that I say over and over and over again that I've said 10 times because it really needs to be repeated. This is where the predatory stuff can happen. People going in, drawing blood, doing Dutch tests, doing saliva every 3 months, changing their hormones, getting the compounded medicine from that doctor's office. I'm calling shenanigans on all of it. There's a
Mhm.
time and a place for blood work in very specific circumstances. There's a time and a place for compounded hormones
Mhm.
because, and we'll talk about definition in a second, because maybe you can't tolerate this dose, or if you need testosterone, the only way women essentially can get testosterone is at a compounding pharmacy because the FDA and all of their glory doesn't approve of whatever testosterone in women. It's a whole other story. But in general, that's not necessary. And I think this is a response to not having adequate access to well-trained physicians in this area because we are not well trained, and
Mhm.
we gave it up and we're like, we're not doing that. So then other people step in who have varying degrees of knowledge, uh, and they're doing all this stuff, some of which doesn't really make any sense. Just
Mhm.
being honest with people.
Yeah.
I have colleagues that are naturopaths that I love, that I think are way smarter than me in a lot of ways. I refer out to Ayurveda and to acupuncture and Chinese medicine all the time. It's a completely different paradigm. It works extremely well for many people. This is about having a deeper, wider toolkit, making sure you're advocating for yourself, making sure you understand your basic health, what your goals are, and how do you want to try to feel right now. So
Yeah.
if you feel good on the dim, great. If you feel flat on the dim, there's nothing wrong with you. As far as I can tell, I'm not your doctor.
Yeah, no, there's nothing. It was just like a little like, oh, let's try a little dim and see what happens if we take the estrogen down.
Yeah.
And I did, and there's such an obsession. It's like in the zeitgeist now, like estrogen dominance, and here are all the things you should be concerned about, and just lowering it to a level that somebody is considering to be non-dominant and a healthier level. Um, my like already tiny boobs felt kind of like empty. My
Mm-hmm.
personality felt a little more like flat and less
Mm-hmm.
feminine. I felt like
Mm-hmm.
maybe my skin didn't feel as luscious. Like,
Mm-hmm.
and then on the flip side, so it's like estrogen dominance at a certain point, and then you like flip right into now you need estrogen. And it was like, what, you know? So
Well,
I'm happy to
it's
hear you say this.
confusing. So that sort of leads us to this conversation about hormones. So the thing with hormone therapy is that, again, people get to make a choice. You are going to feel different without the same experience of your hormones. You are just totally describing exactly what many people go through. You get to make a choice about how you feel. And if part of the toolkit involves or leads you toward hormones and they're working for you and you're using them safely, and we'll get into that in a moment, I think it needs to be a part of your, it should be on the menu of options, right? There are many, many, many large studies showing that women who take hormone therapy as they make the transition and beyond, actually there are many health benefits. All cause mortality is reduced. It is absolutely not true that it's deathbed and get away. I mean, I'm not going to get into a lot of the Women's Health Initiative, but I think if people have not yet read the amazing article in the New York Times Magazine 3 weeks ago, which is titled "Women Have Been Misled About Menopause," I really want people to read this, because you will understand why you may have the fear of God that was placed in you as a kid because your grandma or your mom got pulled off of her hormones in 2002. And I'm going to leave it at that. So what happened, I think, is very interesting. Two things. People got freaked out about using hormone therapy. They got freaked out about pharma, and they got freaked out about medicine. A vacuum was then created, and a lot of stuff came in to fill the void, a lot of alternative practices, many of which I think are important and helped us learn. I think the rise of what we call bioidentical hormones 100% is related to that.
And so is
But
bioidentical from yams?
okay, no. So I'm going to define that. I'm going to finish the thought, and then I'm going to get into definitions. But I think it's also gotten into a business model and a lot of confusion, and people preying on confusion, and people maybe even having the best intentions. And, people don't know what they don't know. I'm going to give people the benefit of the doubt. But I know for a fact there are also practitioners out there that I'm like, what are you doing? You really should know better. It's not safe. There's no data to support it. And women are spending a lot of money who have it or don't have it, and they're not being cared for it properly. And it's not safe, and it's not okay, and it's misogynist. Okay. Now, having said that, bioidentical is a marketing term. I don't care. So I don't care. I'm speaking a language, I'm speaking to you. I'm not at a medical conference, okay? But bioidentical, it means not where it comes from. It means it's biologically identical to what your body has been making. That is all it means. It doesn't mean it came from a yam or it came from a human ovary. The only thing that would be identical would be if you took your neighbor's ovary, ground it up, and you used it, which you're not going to do. That's craziness. And it's not superior because it's from a yam. I mean, some of the bioidenticals that are pharma or compounded do come from plants. 30% of our pharmaceutical medications, 30% come from plants. We got medicine. This is how humans have always lived. Plants are medicine. You think it's different now? It's not. Conventional people don't always understand that. That's white supremacy and colonialism, right? They think that they figured it out in the last 100 years, but the indigenous people didn't know what they were doing. No, you're stealing the indigenous medicine and making it your own. Another conversation. But this stuff is very, very important for people to understand. So bioidenticals are made by pharma as well, and are FDA approved, and are highly regulated, and very safe and very effective. And your doctor can write a prescription, and you can pick it up at whatever pharmacy you would like to pick it up at. It's not better because you paid more and it was compounded. Compounding pharmacies are amazing if you know the compounding pharmacist. So that is a specialty pharmacy where the pharmacist is actually old-timey putting the meds together. Now, where do you think they get their base products from? Possibly the same place pharma did. They didn't grow it in their backyard. So people really don't understand this. And when they do, they're like, their minds are blown, right? So I always use bioidentical hormones in my practice. I always start with FDA approved. They come in patches, creams, pills, gels, you name it. We are going to find something that's going to work for you. Vaginal, systemic, we don't have enough time to talk about all of it, but you can pretty much do everything you need to do. Deal with both the symptoms that are bothering people, like the hot flashes, the vaginal dryness, the heart palpitations, the mood stuff, the sleep. And you're getting long-term benefits to your health. Start it during perimenopause. Within 10 years of the cessation, but even earlier is probably better, before the age of 60, we see decreased risk of osteoporosis, decreased risk of heart disease. The dementia brain thing, we don't really understand. That data doesn't exist yet. I think we will see that it helps. We cannot say that with authority at the moment, but we do know that women, postmenopausal women, have much higher rates of dementia than men. It's definitely estrogen related. So these are very important uses of these medicines. And again, it's in the toolkit. It should be on the menu for you because the symptoms bother you, or because you want to live longer and live healthier. There are people, it's not available to everybody. There are certain people who won't be able to use it, but actually more people can use it than think they can. And if, for instance, you can't tolerate a dose or a format, then the compounding is amazing. I have some patients who can't tolerate progesterone in a higher dose, so we play with it. There's things this is again why working with somebody who's really knowledgeable and can be creative and knows the resources in the community is very important, because it's nuanced and it's going to change over time. It's not going to be, you're going to come in at 40, have the prescription, have the plan, buy. No. It's going to keep changing as you do.
And so I feel like the number one, the two questions that I get is, what about cancer? I have a long family history of breast cancer. Am I a candidate for being able to do that?
So this article addresses that head on. A lot of the fear that came out of that was from this Women's Health Initiative, and it really was a misinterpretation of data. And if for anybody who really wants to do a deep dive, read the article and then actually read. Here, I'm going to show some. The only book that I have read that is not my own.
Oh, wait, will you take your
Yeah,
sticky?
well, I've got my sticky on there.
Estrogen Matters. Okay, beautiful. Thank you.
And I just met last weekend and absolutely fangirled the shit out of them. They were so great. So that's a really interesting book, but it is not quite that simple. It is really not accurate. If you are a carrier of a genetic predisposition, that's probably a different conversation. But also the thing is that we know is that it's not estrogen breast cancer. That's not how it works. First of all, breast cancer is more than one disease. Second of all, just because a lot of breast cancers have estrogen receptors, that doesn't mean that estrogen is causing the breast cancer. And actually, we're starting to see data that is indicating that estrogen may not actually increase mortality from breast cancer, especially in early breast cancer survivors. So this is third rail stuff, because the data actually doesn't support a lot of what we're doing. But just because you had breast cancer in the family does not mean that you cannot use hormone therapy. And I want to say this too. Look, if you've had a stroke or a blood clot, no, you can't use it. You can't. That's the big no. Vaginal estrogen for both urinary symptoms, just dryness in the vaginal area, and for sexual function is safe for everybody. Everybody can use it. And if they want to use their vagina, they probably should. It's not absorbed into your rest of your body.
Amazing. And then the other question is around how early can people start? And so I heard you kind of talking about, could it potentially be used as something preventative? Is it something?
We know that it diminishes risk. I mean, I think there's a difference, like this is where language does matter. Prevention, we're never, like, we can't say for sure it's preventive, but it definitely does appear to decrease risk. But my professional opinion, and this is also the opinion of the North American Menopause Society, okay, I'm not just making this stuff up, is that anybody who's in perimenopause and suffering and wants to use that as an option, it should be available to them. I do have people come to me all the time, and online people ask me all the time, I was told I can't use hormones until my period is completely done. That is false. That is not evidence-based. It's also not nice. Like if you're 37 and you're really suffering, progesterone in the second half of your cycle may be a complete and total game changer, So yeah, people can start that whenever they need it. Again, we are supporting people through a process that may be difficult for them. These are some of the items that could be helpful to them. But it does look like people who start a little bit earlier may actually have decreased risk and have better longevity going forward. So that's interesting.
Okay, interesting. Okay, so then, I recently read this thing about, and I had always thought we were born with all of our eggs. And so I had this vision of like, oh, my eggs were inside my grandmother and they're all there. But then, also working with TCM and acupuncturists, and there's the Weston Price where we're doing things to increase the vitality and health of an egg. So I guess that's contradictory, but can you blow our minds with that? I feel like that's a really nice thing for women to hear, just around egg production, and that's
Well, I mean, you know, you're actually as a
Like
fetus,
sperm.
you have more eggs as a fetus. You're actually losing those eggs. You're not ovulating. I guess they're just like sort of dying. I mean, look, it's millions and millions, and then you're born, like, you know, with several hundred thousand. You have a lot of eggs. Okay, so everybody take a deep breath. But yeah, you're losing those eggs even before you're born. You still have a lot of them, but once you get to a certain age, it's not so much that even that you don't have eggs, like you definitely are running out of eggs to some extent, but it's also the ovary. It's not just the eggs. The eggs are being monitored and distributed by the ovary. So just like all the organs in our body, the ovary is aging. So the ovary is functioning differently, and also the quality of the egg is declining. So that's, you know, so I don't know if that's what you're asking, but
Well, so I was reading this thing and it could also just be quackery that I stumbled
okay.
on.
Yeah.
So you'll have to tell me, but it was saying that we're not born with all of our eggs and that we continue to produce eggs in our lifetime.
No,
That's
wrong.
quackery. Okay.
No, in fact,
It was going around.
during your fetal life, you have more eggs and you already are losing them. You're born with a certain number. No, you're not making
They're
them.
not creating.
You can improve, you can change the quality though with nutrition and all these other practices that you're talking. You can change the egg quality. And
Okay.
that's, I think, what becomes a big issue for people with fertility specifically.
Yeah. Okay. And then, okay, so my last question, and then, let me check our time here. We'll kind of, maybe I'll ask one community question, but what is happening for these very rare cases where you'll see a woman give birth, natural pregnancy and birth in like 60s or 70s, they're like rare cases, but they're out there.
Okay, so people in their 60s and 70s who are having babies, I would like to see the proof that that was a spontaneous conception. That's probably in vitro with with donor eggs. I have a patient who, I have a couple of patients who've had family members get pregnant spontaneously in their 50s. Like,
Mhm.
I mean, I can think of in 26 years, like 3 people, nobody in my practice.
Mhm.
So what's going on with them? They are genetically different. What can I say? Look, I'm 57 and I just told you I'm actually not in menopause yet. I think this is it this year. 57. I'm like, what in the hell? And it
Yeah.
turns out my mom, because my mom had a hysterectomy in her 40s, so I didn't know. And I asked her, I said something like, I don't know what to expect. I was like 53. And she said, oh, but your Grandma E, her mom, she had her period till she was 55, which I was like, what? So
Wow.
it's genetic, right?
Yeah.
And I am like the same body shape as, both my grandmothers, but there's something genetic. I don't know why.
Yeah. And then what about people that go into early menopause? And this
Yeah,
is, we had some community members and I actually had some friends that let
yeah,
me, like, I went
yeah.
through menopause at 31 and there wasn't some of the other medical events that you had mentioned. It was just like, it happened.
It's so hard for people. Let me just say that, like, it is so that talk about isolating. Wow. So that's what we call premature ovarian insufficiency. That's actually a medical issue because they're also missing out on estrogen. These are people who 100% should be on hormones because, as I mentioned earlier, they now are losing out on all that bone health, brain health, heart health, not to mention symptoms, right? Like, you know, creaky, dry, blah, blah. So it's really, really important for them to therapeutically be using hormones. That generally, first of all, a couple of things. That is almost always genetic. Some of it, there is something called Fragile X, which actually people who have contemplated pregnancy or been pregnant may know about. And it's literally where one of the X chromosomes has a area that makes it fragile and a piece can break off.
Mm,
Now, if a male inherits that X, they actually can, it's one of the most important causes of um, developmental delays, more common actually than Down syndrome. So they're literally missing a piece of information. In a woman, you have two X chromosomes. So you're missing that information, but these are people who, even if they're just the carrier, they didn't actually have the Fragile X, but they have a carrier state where they are at risk. These are people who go through menopause earlier. So that's one reason. Usually it's a genetic thing. There could be another reason. Somebody could have had a major medical illness, chemotherapy, a surgery. severe eating disorders, especially at the wrong time in your development, can really predispose you to having ovarian dysfunction for life. So these are medical issues and they need to be treated really, really carefully, because there's also so many cultural markers and shame and just fear around that. So that's a totally different thing. And it's not like somebody did something wrong. You know what I mean? It's not like, oh, they were exposed and they should have known. I just don't want people to be blaming themselves.
Yeah, yeah. So I feel like we got into a lot of the community questions just through conversation. And if you have time to answer one, and I'm
Yeah.
going to refer people, we had a lot of questions just specifically around the combi patches and testosterone cream at 40 and progesterone at 40 and weight gain and migraines and
Oh,
night
yeah.
sweats and insomnia. And so I'm going to say that you touched upon it in conversation, and people can go into menopause boot camp, and that you actually give way more detailed information
Yeah.
as the first step. And then the second step would be for people to find a doctor that can help
Right.
with this.
Right.
Could you just give us like very quickly a checklist of, if somebody cannot see you, what should they be looking for in somebody to help them navigate?
I think really, especially when you're looking for medical support, I would go to the menopause.org website. That's the North American Menopause Society, and that is sort of the most important academic governing body in North America. Now, I sometimes they're a little more conservative than I am, but I think basically it's very highly vetted, data driven, and people who really care. They've devoted their lives and their professions to understanding this time of life and supporting women. So they have a physician locator. They have lots and lots of public information available too, like, one sheets on all sorts of topics, very highly educational. That is a great organization. The other one is to look at International Society of Sexual Medicine.
Hmm.
They have other bodies. The North American arm is, this is a mouthful, ISWISH, International Society for the Study of Women's Sexual Health, ISSWSH.org. Both of these will have physician locators. So you may be able to find somebody close by to you, or somebody who does telehealth. I do telehealth also. And then I think some of the newer platforms, I think Geneve, I think Alloy, I think Evernow. These are really excellent online platforms that are serving women, and that are really looking at making sure that women are getting trained health professionals so that they can navigate the space, because it is going to be maybe hard for a lot of people to find somebody in their community who really is really devoted to this in a specific way.
Yeah. Um, and I wanted to end on the silver lining and the gift, but I think we started the conversation there, which I'm grateful we
That's
did.
fine.
The last thing that I just wanted to ask about is pregnancy in your 40s, pregnancy at 42, 43. Is that potentially going to change anything for perimenopause? Could it stave it off? Could it bring it on in postpartum? Does that have any effect, or?
That's a great question. I don't think we have data on it. I really, my suspicion is that it wouldn't change it. I think it'll change your experience, because I think what's going to happen is that, and I have lots of patients, especially in this community, who are having pregnancies in their 40s, and a lot of them are spontaneous pregnancies, So let me just say this. I think my patients in their 40s sometimes think two things. One, I can't get pregnant. That's not true. Or two, I know my cycle, I'm on it. I'm like, yeah, but do you? Because your cycle is about to change. And this is, by the way, early 40s is when people have a lot of unplanned pregnancies. So I'm just warning y'all to take that seriously if it's not what you want. Having said that, I think what happens is if you have a baby at 42, and you're breastfeeding, now you're 45 and you have a toddler and you're squarely in perimenopause. I think it's hard. Perimenopause is hard. I did it with teenagers, and everybody wanted to kill everybody in the house. You know what I mean? So I can't even imagine. I'm 57. I have kids in their 20s, and I am freaking exhausted, and I'm not even making dinner for anybody. Okay, so God bless you. I don't know how you're doing it, but I think it's hard. But I don't think there's evidence to support that it would cause a problem unless you had like some severe complication, like a postpartum hemorrhage that, changed your brain or something like that.
Yeah. Yeah. It's just the sleepless, the
Yeah.
three.
Well, you just
sleepless-
kind of go, you just sort of, maybe it's a seamless
different-
transition.
You're in your 40s. I'm so appreciative of the work that you're doing and changing the conversation for us and being an inspiration and yeah, helping to share other people that are doing the work and the Estrogen Matters book. We're going to bookmark. You listed off a bunch of sites we can go check out.
Great. Yes.
Or to also get the information about your boot camp happening in April.
Yeah.
You wouldn't mind
Yeah,
sending?
absolutely. I think what I'll do is as soon as I know, I will let you know, but also just start following me. If you follow Ask Dr. Suzanne on Instagram or the Menopause Boot Camp on Instagram, if you search me, you're going to find me. You're not
Okay.
going to get away from me. It'll all be on there. So yeah, people in LA, that's going to happen. And that's going to be really fun because we haven't been able to do it in person for a while.
Yeah, amazing. Thank you so much. And I hope
Oh,
I hope to be at that menopause.
yeah, well, we'll talk. Well, I would invite you. How's
Yeah,
that?
I would love that. I would love that. Thank you so much. Thank you, thank you, thank you.
Oh, thank you, Amanda, for your interest. This was amazing.